Swayam Prabha. Digital India. Educated India.
Welcome friends to this NPTEL MOOC module on health economics. We are right now in week number 5, that is unit number 5, discussing the important aspects of health economics, that is called health financing. We already discussed the background of health financing and its need in the last lecture. Now it's quite important for us to address how the individual as patient or the household are actually trapped under certain forms of burden, and that burden how it is dealt through health insurance. So, largely the burden is conceptualized in economic literature is through uncertainty and risk. So, we will be emphasizing here on uncertainty and risk and how far health insurance is addressing these two. So, as a recap of our previous lecture, we discussed about healthcare financing, national health accounts in particular, and identify the impoverishment effect of healthcare payments and an out of pocket expenditure. Health is, as we know, uncertain, and coping measures to prevent impoverishment due to unexpected high health spending are indeed required. So, what are the learning goals of this lecture is on uncertainty of health risk, risk pooling and health insurance, then patient payments. So, we will be discussing patient payments through various type of payments and their distributional effects, and also we will talk about policy option of applying negative patient payments to increase the utilization of some types of health care. So, what are your expectations then after going through couple of lectures on financing? Yes, of course, you can apply for various consulting work. Maybe you can apply these latest arguments in your research or in your project writing. And besides that, I think the hands-on numeric examples which you have given here would be highly useful for answering the questions, especially for the exam, final exam, as well as for the internal assessments. So, we have tried our best to present the discussions very carefully, and we have our TAs which are who are dedicatedly developing the content, and your queries will be addressed carefully. So, let us go further, and to understand the healthcare financing and the uncertainty and risk in particular, we need to take the help of probability, expected utility, expected value, variance and standard deviation, etc. So, the first obvious question is, what is uncertainty? We do not know what lies in future, and we also quite uncertain about our future. Do you know if your house is burned or will burn down, or you may or the car which is owned by you may be stolen, or you may get sick? In that case, uncertainty really attached in every sapling of our life, and that is used to be occurring at a friction, hardly projected. However, there are some average tendency of the uncertainties that can be projected. Hence, the insurance company might take a average value of our predictions regarding uncertainty and may address the issue of risk. So, uncertainty in healthcare in particular, where consumers do not know if they will ever need healthcare, where the incidence of health need is very random, and even they do not know the full financial implications of illness. And we will also talk about here what is this full financial loadings, and whether the post payment loading is better than that of the prepayment reservation of health needs through payment of premiums. Which one is really beneficial, we will be addressing in detail. Now, so hence to avoid financial uncertainty, the consumers used to take out the health insurance. Can you insure against the risk in all above mentioned events, and insurance against financial implication is really possible. We will discuss all sort of things. Hence, we need to compare the uncertainty and risk. Uncertainty refers to, as per the famous American economist Frank Knight, uncertainty refers to situation in which many outcomes are possible, but the likelihood of each is unknown, where the risk is really discussed in the context of quantifiable uncertainty. Okay. Therefore, it says that as per the definition by Frank Knight, risk refers to a situation in which we can list all possible outcomes and also know the likelihood of each occurring. There are some examples we have mentioned here. A new infectious disease outbreak often involves high degree of uncertainty, whereas the risk assessment of a patient developing diabetes based on factors such as age, family, history and lifestyle, etc. So, we can actually predict or calculate the possible outcome of diabetes through cofactors. So, we will address all sort of things. Let us start with certain direction called risk pooling and insurance to address the issues of risk. Okay. So, what do you mean by insurance then? It is a pooling of individual financial risks across all members of the pool. Large and unpredictable individuals, in that case, if it is this case, then we will have through risk pooling we will have a small and predictable individual risk. So, risk pooling is indeed required to reduce the problems of risk. Participation in risk pooling is either voluntary, that is through private insurance, or compulsory through tax funded or social insurance. So, if it compulsory or voluntary patterns, and insurance is basically a contract in which an individual of entity pays an insurance company in exchange for financial protection or reimbursement of losses resulting from a covered event. Here we are discussing these things, how money pooling really helps. We start by an example where Pragya, a name, Pragya and three of her friends had a cool idea to make their own health insurance funds, and they pool their share of money to their class teacher with condition to that one who gets sick will get all the money. Pragya's three friends were staying at the school hostel, but she went home every day. One day when it was raining heavily, Pragya got completely wet on her way back to her home and ended up getting sick with a fever. She got all the money due, to pay her treatment due to pooling of funds. So, Pragya, in this picture, in this interactive one, we have explained how pooling really helps someone who is attached to some forms of risk. So, you can just have a check once again we try to pool it. First, there are 4 friends including Pragya. They have started pooling their money, and at the time of some catastrophe or some forms of disease, as we have mentioned here, Pragya faced with rain, and due to that Pragya got sick, and we have changed the color. You can just mark here. Okay. So, and all the amount is actually now shared with Pragya. So, this is how the friends or the pooling of money really helps at the time of need. So, now we are explaining pooling across equal income and pooling across differential income. If there is a risk, there are low, it might be low risk or high risk. Pooling to here we are mentioning pooling to redistribute health risk. So, the contribution would be like this with low risk individuals, their transfer will also be highly useful. For the high risk one, now you can compare that some of their funds is also useful for the patients who are attached with high risk. So, this will be useful. Now, here in this diagram we are explaining cross subsidization or cross subsidy across equal risk. Now, you can just have a check cross subsidy for greater equity. Now, income with those who have high income. Now, in the previous one we started with risk. We started with risk. So, risk are of 2 types and how the contribution is actually redistributes. But now, in this one we are discussing about income. There are 2 categories, low and high. However, with high income categories, their income is actually redistributed through sharing with the premium, and that is actually useful for the one who have low income. So, the net transfer from the high one is actually highly useful, and in this case that actually helps in redistribution income and welfare. So, now we are explaining microeconomics of health insurance. We will cite the example of Pragya once again. Pragya and her family has a total asset of rupees 35,000, and there is 1% chance of Pragya getting sick in any rainy day. The treatment cost is actually rupees 10,000 as per assumption. So, 3 things I have mentioned. One is starting with the W I have mentioned, wealth, then risk age is of 1%, and the cost of treatment because of getting sick is of 10,000. So, now out of 35,000 with 99% probability that Pragya will be in good health, hence there will be no expenditure. So, 35 is intact. With 1% probability, if Pragya is sick, then 10,000 will be deducted, and what is left is of 25,000 with her income or wealth. Now, we are discussing about another case. Her class teacher came up with this idea that if she gives him rupees 100 as premium basis, then as premium basis he will pay her treatment cost of 10,000 rupees when she gets sick. So, if the 100 rupees as premium is paid by Pragya to her class teacher, then the class teacher will actually reimburse 10,000 rupees. Hence, with that 99% probability as good health, Pragya will end up with since 100 rupees is paid as premium. So, 34,900 is the income left with her. However, in the case of sick, 1% probability we have attached, and we know that 10,000 is actually paid for health treatment, and if premium is already taken, in that case 10,000 is actually going to be reimbursed by her teacher. However, rupees 100 is actually paid. Hence, the total income is still remain the same as against the good health case. Hence, in this case Pragya will end up with 34,900, and program will now fully insured against loss. Now, we will discuss a generalized context by taking the nth possibilities one by one. In general, if Pragya purchases insurance of rupees k with premium of maybe in that case we have said 100 as a certain percentage of the insured amount. So, hence we have said it is gamma times certain proportion of the sum assured amount, and that is in fact called gamma. So, gamma times k is to be paid. The probability, as we already uttered, is 1%, hence it is 0.01% of getting 25,000 plus k. K is the insurance of rupees k minus gamma k, and probability of good health. So, that means only this much is deducted, that is in our case it is of 100. Okay, so 34,900. In both the case we have seen that once insurance is reserved from the beginning of the period, then the wealth is considered to be reserved and equivalent. If you purchase rupees k worth of insurance, you give off gamma k of consumption possibility in the good state in exchange of k minus gamma k of consumption possibility in the bad state. Hence, individual preference matters while choosing insurance plans, and we know that there are three possibilities of risk, and on the basis of that we can estimate in which context the actually consumer or the patient is ready to, or the normal individual is ready to bear the insurance. So, there are actually perceptions are different. One is maybe risk neutral type, risk averse type, and risk seeker or risk lover type consumers. In this case, some of the example you can cite, that is the person who used to smoke and who does not. So, in that case you can easily expect who will be more risk lover and who will be risk averse. Of course, the one who is not taking smoke or not smoking regularly will be preferred to be risk averse. So, hence the utility functions for us is presented like this. We have a probability function and consumptions in different health state. So, and C1, C2 in this case are mutually exclusive states of the nature. If you are actually consuming one state and we have to compromise and compensate the other, hence it is mutually exclusive consumption. Let C1 and our utility function, hence it will be probability and its consumption function. So, we know that there are two probabilities and two state of consumption based on the risk the person is bearing. So, C1 and C2 represent consumption in health state in 1 and 2 condition. Let pi 1 pi 2 be the probabilities, that is state for 1 and state 2 if any occurs. So, there are contexts we need to emphasize in case of perfect substitutes case. So, the utility function is projected to be linear, as we used to see in our consumption function. So, our utility function the probability times its consumption in state 1 and in probability times its consumption in state 2. Whereas, and this is indeed called the expected value, since we have attached their probabilities in both the conditions, okay, and this tends to be our average level of consumption. Another condition of the utility function is of Cobb-Douglas type, Cobb-Douglas utility function. So, it is in fact C1 to the power its probability, respective probabilities, into C2 to the power pi 2. So, it is hence this can be linearized for for the expected value. We can take the log linear function of it and find out the average value. And the expected utility functions we have presented so far is on average functions using the Cobb-Douglas utility function. But the most important referred context for the expected utility function is through von Neumann and Morgenstern utility function, and in that case it is presented as pi function of c pi 1 and function of c and it linearized through its respective utilities. Hence, utility can be written as a weighted sum. So, basically the weighted sum is taken and the expression represents the average utility and the expected utility of the pattern of consumption C 1 and C 2. Hence, what we have presented just now is in our case is actually V C stand for C here, and in our another case it is V C stand for log C. Okay. So, let us apply expected utility framework to simple choice problem. Suppose Deepak has a wealth of rupees 10 and he thinks of gamble that gives him a 50% probability of winning either rupees 5 or 50% probability of losses of that is minus 5 or 5. So, the expected value of the wealth can be calculated with the probability of 0.5 times either it is minus 5, 10 minus 5 or 10 plus 5. Hence, the expected value of wealth is 10. And the utility of the expected value is basically utility of this expected value, that is utility of 10, and expected utility of wealth. What is this? This is basically we are multiplying with the probability and its expected utility expected value. So, it is indeed this 0.5 of this one, 0.5 of this. So, 0.5 of utility of 5. So, this is precisely the change in the value of wealth, but here we are saying even if it is as it has been changed, it has been reduced, the utility might have been increased. So, the expected value is considered to be different. Okay. And now, this is how it the expected value of wealth is presented. All right. Now, we will be presenting in a diagram to explain it very clearly. We start by citing the case of risk averse individual. Okay. A person who is risk averse has the utility function which is concave to the origin, and we will also give you the example of its equation form at the end and used to be square root of the utility or the value. I'll come to it. Now, at this moment, now you can just have a look if utility function like this, we have taken wealth and its utility, and we know that utility level increases at an increasing rate initially, then decreases at after certain level of wealth, and then there might be a maximum possible points. Okay, so we will discuss all sort of things. Now, I will be emphasizing on this, and here we have presented its average value, the expected utility or expected wealth by taking the maximum possibility at 5 level at 5 and 15, 10 minus 5 that is 5 and 10 plus 5 at a 50% probability case. So, we will discuss this now. You can just have a check. This is what is our 15 here and 10 5 there, and we have projected it accordingly. Now, the expected value, the utility of the expected value is at this point is highlighted, and the expected wealth is actually 10. So, but the expected utility is higher than that of the expected value of wealth. So, Deepak has a concave utility function, as I already mentioned. The utility function is in fact is presented over here 0.5 times 15 plus 0.5, that is half of the probability is half times 5. So, the utility is of the 10 is now greater than, this is how it is highlighted, is greater than that of the expected utility of wealth, expected utility of wealth. So, now initially we said utility of expected value, then this is expected utility of wealth. This means that 0.5 times utility of 15 plus 0.5 of utility 5. So, the average value is actually lesser than that of the utility of the expected value, So, in this case for a risk averse consumer, the utility of the expected value of wealth is greater than the expected utility of wealth. So, the consumer will prefer to have the expected value of the wealth rather than face the gamble. Okay. The consumer will actually prefer to have the expected value of his wealth. They prefer to have the expected value his wealth rather than to face the gamble. Therefore, we said they are risk averse individuals. Now, on the next diagram we are mentioning about risk neutral, where the expected utility the consumption function or the utility as a function of wealth will be straight line, and expected utility of wealth is equal to the utility of its expected value. So, now here this is the utility function. Now, we are presenting the expected value of wealth. Now, this is expected utility and utility we have presented initially, both are now the same. Hence, these two are actually equalized, and since they are the risk neutral individuals. Now, we are presenting risk seeker or lover individual. In that case, the utility function as a function of wealth is actually convex to the origin, and in that case the average value of the wealth utility value is actually higher, and you can just check it is just the reverse than that of the risk averse individuals. So, rest we have presented here. This side we can see a greater than the left hand side is lesser than that of the expected value. So, the for risk seeking consumer, the utility of the expected value of wealth is actually lesser than the expected utility of wealth. So, so consumer prefer a random distribution of wealth to its expected values. Welfare gain from insurance, how to present it. So, you can see this is how we are presenting in terms of equation. So, these are all details mentioned. Welfare gains for risk averse individuals. Welfare gain from insurance can be illustrated by considering the relationship between an individual's wealth and their utility. So, if insurance is there, money loss due to illness will be actually compensated, and cost of this is guaranteed, or cost of this guaranteed compensation is specified as the premium P. So, we have actually mentioned all those things. This is the total wealth and the minimum wealth left out of the risk attached, hence the expected value are different, and this is what we are presenting in the context of risk averse individual. And in this case we are actually discussing another context in another unit of our module. We will be discussing part of this in unit number 7 as well. Unit number 7, where economics of health system, we discuss about the actuarial fair premium, etc. So here the P which we have used or we are using is actually gamma times K. This represents the insurance company's expected payout, that is size of loss multiplied by probability of loss occurring. At this premium, insurers can expect to pay out same amount compensation as they receive in revenue from premiums, and this involves no profit and no cost of administering insurance. So, as P increases, this is premium increases from P equal to gamma times K or to P equal to P star. Okay. So, this is what is given, so that the we can get the higher utility of the expected value, and P equal to P star, that means this reaches the maximum premium of the consumer will be willing to pay. Some of this discussion will be taking it in detail in unit number 7. The later two lectures of that unit 7 will be useful. Hence, the wealth after insurance premium will be W minus P, that is precisely equal to P is here our gamma times K. So, utility without insurance will be gamma times utility of W minus K plus 1 minus gamma times utility of W. All right. So, this will be less than that of the utility with insurance. Okay. So, as premium increases from gamma times k to p star, welfare again decreases to 0. So, you can just follow from our numeric example and further clarify all sort of details. Okay, this is what we have said. If this is actually tends to reaching at a equal level, and welfare again decreases to 0. So, this is basically called utility with insurance, which we have highlighted here. All right. And the gap you can see the gap which we emphasize, and we are actually emphasizing again in our next lecture on actuarial payment. And this vertical distance we also will discuss about how much the actuarial payment is required to ensure the equivalent insurance package. I am sure you will clarify in our next unit in detail. So, so to clarify further, here are some questions, and we will actually give you some directions. One question here we have kept it for you is draw following utility function as function of wealth of individuals and identify which one is risk averse and or risk neutral and risk seeking. So, three functions are there. The first one is utility is equal to W square, another is W. Second one is for sure it is the linear function, and I am sure you can guess it from the equation. And this is of course a risk neutral one. And first one you can just have a look. We have also given answer in our case. Suppose that Laura has a utility function, this is square root of W, that means it is a concave function, and an initial wealth of rupees 100 or $100 is given here. How much of a risk premium would she want to participate in a gamble that has a 50% probability of raising her wealth to 120 and a 50% probability of lowering her wealth to 80, since we have said that 50% probability. So, so in each of our case you will find these answers in the neutral case or in the risk averse case you will get these answers. So, even further details we have kept it here for your reference. I am sure you can understand, and this is the risk averse individuals. So, the risk premium we have highlighted, our utility expected utility would be this much. This is what is given. Her expected utility to be 100. This expected wealth of $100 is indeed uncertain. We would like to know the amount that she would accept with certainty that would give her same level of utility as the uncertain $100. So, expected level of utility with its risk premium we have mentioned as RP, and this is nothing but R 9.949. Squaring both the sides gives us the risk premium as 1.011. In this case, Laura is actually indifferent between a certain income of that is 98.989 and an expected income of 100. She needs to pay risk premium of 1.011 to avoid the risk. Now, we will be discussing other details like patient payments, etc. I think we can keep it to our next class. Okay, I am sure you will get enough time for your preparation, and so that rest of the detail as a sequence to the understanding of other payments, we will actually take it forward in our next class, and I think it will be very useful. So, I will cover in the next class about patient payments and other details. So, it is time to close. So, thank you for participation.